one of the alumni. Dr. Mkhize, Dr. Mkhize.
Hello, can you hear me?
Oh, yes, I can hear you.
Sorry about that. Hello,
Oh, yeah.
can
Oh, yes, that's saying that today we are joined by Dr. Mkhize from, I'm not sure, I think I'll butcher the name of the hospital, but I'll try. It's Kalafong Hospital, but I'll give Dr. Mkhize to just introduce himself and also just tell us about the hospital, which province is it in, and also which town, just a brief introduction.
Good evening to everyone. I am Sibusiso Mkhize, first year medical intern at Kalafong Hospital, which is in Gauteng in Pretoria. The hospital is allocated in Atteridgeville. Yeah.
Okay. Mkhize is one of our UK's in alumni. Once part of the MCRC. So yeah. So we just a few questions for you. Hopefully you got like the pre-questions that come like that on the way and other questions from students which were sent prior to the meeting. So just to kickstart our session, so can you tell us like about how like working in Kalafong Hospital is, like the working hours and also the rotations you have done so far?
Sure. So I have done obstetrics and gynae. That's what I'm currently doing right now. I've rotated in internal. I've also rotated in general surgery. So after first year rotations, I'm left with pediatrics. Yeah, that's going to be the last rotation. In terms of the working conditions, so I've just separated a bit of it depending on the different rotations because they're not all the same. So I'm currently doing obstetrics and gynae. As you may know, you do 2 months of obstetrics and 1 month of gynae. So I'm nearing the end of my second month in obstetrics, and then I'm going to do gynae next. So as far as obs and gynae is concerned, the normal day to day is manageable. It isn't much. You are allocated to a firm at the beginning of every month, and then you are expected to do the firm's ward work. And beyond the firm that you're allocated in, you are also allocated to a different section in obstetrics. And so, if perhaps you're covering theatre, the expectation is that you're going to come in very early and prepare the elective cases for the day. So you come in, make sure that they have signed consent, you follow up blood results, put up IV lines, and just make sure that at 8 in the morning when theatre opens, you have the first patient prepped and they are ready to go. The other part that you may be allocated to is Ward 10, that's the postnatal ward. The postnatal ward is primarily run by interns. So when you get there in the morning, after the morning meeting, you're expected to just go to Ward 10 and see all of the patients. At best, there are 2 of you. but sometimes it does happen that you're alone there, and the expectation is still that you're going to see all of the patients, and then you will round with one of the seniors, whichever senior is allocated to Ward 10. So you'll communicate with them, make sure that they know when you're done, so that you can round with them and discuss any problematic patients that you may have had. Um, yeah, so that's just postnatal ward. Sometimes it's a very good ward to rotate in. You come, there's two cubicles. Sometimes you come, it's completely packed, and yeah, so it varies. But on a good day, you will finish very early, and you'll be able to just discuss your patients and carry out whatever management the senior suggests. Um, yeah, and then the other part that you may be allocated to is ANC. That's the antenatal clinic. In ANC, for the most part, when you get there in the morning, you'll start with your firm's work again, and they'll let you know if perhaps there's something that you need to do in ANC. For the patients requiring induction of labor, the intern is required to put in the balloon catheters. Yeah, it's their method of choice when it comes to induction here. So most of the patients will get balloons, and the expectation is that the intern will do that. But if you do finish with your firm's work, and even if they haven't called you, the expectation is that you'll go to ANC and start seeing patients, clerk, and there's always a senior there, so you can just present to the senior, and yeah. So when you're on call, you are not allocated to anything else. An obstetrics call starts at 8 after the morning meeting, and it ends the next day. So if you're on call, you're either at admissions or you're in labor ward. Um, Depending on how many people there are in your group, you might also be asked to cover your firm, even if you're on call, but it's for the most part manageable. Um, which brings me to the next bit, which is the calls. There's two interns on call for obstetrics. With every call, there's two interns on call. There are two seniors, usually a senior registrar or senior MO, and junior registrar, junior MO, whatever the case is. But there's always two seniors on call for obstetrics, and then there are also two interns. Um, there are also students on call with you. Um, Kalafong is a tertiary institution. It's also an academic institution, so you will have students rotating there as well. The calls in obstetrics quite hectic. I'm still in scrubs. I'm post call. I came back and completely dozed off. It's quite hectic, very demanding on the body. You're very fortunate if you get time to sleep in an obstetrics call. Yeah, but the expectations in terms of when you are on call, you see patients in admissions. The expectation is that there must always be an intern in admissions at all times. So as the patients come, you clock them, you review them with the senior, you carry out the management plan. Um, if there's anything inside labor ward that needs to be done, if there's a patient, whatever needs to be done for the patients that are already inside labor ward, you will be expected to do that as well. Um, yeah, the calls are quite hectic. You will see quite a lot of patients on an obstetrics call. You will do a few emergency Caesars as well. So you tend to stay up for most of the night. If you're fortunate, you will get a couple of hours of sleep, maybe an hour or two, sometimes 45 minutes. But yeah, the calls are quite hectic. The other thing that I wanted to cover was supervision. The supervision is quite good in obs and gynae. The supervision is really, really good. Um, you will always have someone that you can always call or just ask that they help you out, or if you're struggling with something, There's a lot of first times in internship. There's a lot of things that you're going to be doing for the first time, or something that you haven't seen, and so there's always someone there, senior, who will gladly assist you. They won't hold it against you if you're asking for help. So I've found the supervision to be quite good. Um, yeah, in terms of teaching, it is an academic hospital, but obviously it differs with rotations. For some rotations, the academic side of it is really restricted to just the registrars and the students. You don't get much of it as an intern. I would say Obs and Gynae is perhaps one of those rotations. Um, as you can expect in a tertiary institution, um, the expectation is you should be cutting scissors and all of that type of stuff. But obviously, you're competing with uh, junior MOs, registrars, whatever the case is. So you may find that when speaking to some of your colleagues who are in other institutions, um, they tend to have a lot more exposure in terms of being allowed to cut and all of that stuff. So yeah, I've found that in obstetrics, that's one thing that I would say um, is a bit of a shortfall in comparison to, to other places, based on what I've heard, and I've had discussions on with some of my friends. Quality of life in the rotation, you do quite a lot of calls, uh, which are very, heavy on the body. So for the most part, you spend your free time recovering from the call, and before you're fully recovered, you're on call again. Um, so yeah, obstetrics, quality of life. I don't know if the two can be put in the same sentence. Um, but yeah, the you will get maybe one free weekend or two in a month at most. But you should expect probably one. So yeah, but the with the day to day, at least if you're not on call, you do get to leave early, so you can run errands or rest or whatever it is you want to get up to in your free time. With regards to gynae, which you spend 1 month in gynecology, as part of your obs and gynae rotation. The hours, again, in terms of a day to day, very manageable, very reasonable. Um, you will come in the morning, round, see patients, round with the seniors, and once that is done, you can then do the ward work, and you can assist in clinic if you're allocated to the GOPD. Usually, the person on call also goes to clinic to just assist during the day until GOPD is done. Then there's also the person who is in the ward, so that person does most of the ward work. If there are procedures that need to be done for patients that are in the ward, that person will be expected to do it. So if there's an MVA is an intern's job. Um, yeah, they will teach you how to do them, which is the nice part. But once they have taught you, the expectation is that you should be performing the MVAs on your own. In terms of the calls, for gynae, you're on call with one senior, and there's one intern as well. So one senior, one intern, and then the students as well. You do a reasonable number of interns in comparison to obstetrics. I think obstetrics is obviously going to be the worst in terms of hours and everything like that. It gets better from there. So in terms of the number of calls, you're gonna do at least 5 or 6 calls in gynae, depending again on the size of your group, how many people are in the group. Um, the calls themselves, very manageable. You're going to see a reasonable number of patients. So what happens is the patients are triaged in the main casualty. They are seen there and then referred to gynae. Then once they've discussed the patients with the senior on call, the senior will obviously let you know if it's not something too urgent, then you can go clock the patient, um, and then you will review the patient with the senior, of course. And if the patient needs an MVA, you will perform the MVA. You'll sonar the patient after, make sure that everything is fine. Yeah, so the calls in Gynae are a lot better in terms of number and in terms of just the call itself. The weekend calls, absolutely the best. You're not going to see that many patients on weekends. You will get time to sleep on call. Even during the week, though, you will get time to sleep and rest and stuff. Um, yeah, in terms of supervision in Gynae, again, the seniors are very approachable people. Um, they will help with whatever you need. If you need to ask something, if you need help with something, you are expected to do something that you have never done before, which happens. They will take you through it, make sure that you're comfortable with the procedure before you get to do one on your own. Quality of life much better, much more improved. So you will get time to yourself. You will get time to do whatever it is that you want to do in your free time. Um, yeah, I think that's it with regards to gynae. With regards to internal medicine, one of the most organized departments you'll ever rotate in. Um, it's very clear, you know what to expect in terms of the day to day. When you get in the morning, you will see the patients with the seniors. You'll see your firm's patients around, and then from there carry out the ward work. Um, you will have your consultant ward round once a week. So you'll see the patients and then round with the consultant, and then discuss the management plan for the different patients with the consultants. Again, teaching hospital, so the consultant ward rounds do take long because they also take the opportunity to teach the students. And in the process, you do benefit quite a lot. Um, you will leave internal medicine very comfortable in terms of managing some of the basic conditions that you're going to see on a day to day when you're out there in ComServe or as an MO. So yeah, that's essentially the day to day. So every week you have days where your firm is in clinic in MOPD. You go to MOPD and you assist the firm. There's usually two interns per firm. So if one of you is in MOPD, then one of you is in the ward doing the ward work. Then on the other days, you're just rounding. You may not have MOPD or an academic round, and then you will have your academic round. And then if your firm was on call the day before, then you will go in the morning and start with the post-call ward round. So you see the patients that were admitted during the call, you do the ward work for them, and then afterwards you will see the old patients that were already in the ward, and then you'll do the ward work for them. In terms of calls in internal medicine, you'll do about five, an average of 5 calls per month, sometimes six, sometimes four. Um, the calls are again, okay, internal medicine calls can become very hectic depending on the number of patients that you're seeing and how ill the patients are and what they present with. If you have 6 confused patients who need LPs, if they're delirious or whatever the case is, you're going to have a very terrible call. Sometimes you'll see a lot of patients in general on the call itself, which can become very hectic. You do have 2 seniors on call in internal medicine, and you have 2 interns as well. On the very odd occasion, there will be 1 senior and 2 interns. Um, yeah. Um, you are expected to see patients during the call. Um, the casualty is divided into main casualty and the resus area. So the seniors will prioritize the resource area because that's where the really sick patients are. That's where your DKAs are. All of your medical emergencies will be in the resource area. So they will see those patients and come up with management plans and then let you know if there's anything that needs to be done for those patients. The patients in main casualty, the patients in the respiratory area, those are your responsibility to clerk. They will also help you with seeing those patients as well, because some calls do become very hectic. So the seniors will just see the patients and then you do the work. But for the most part, the patients in main casualty and the patients in the respiratory area are seen by the intern or the students and then reviewed with the seniors. Um, will you sleep? You will sleep on those calls. Some of them you'll end up sleeping for 5 or 6 hours and you'll wake up feeling embarrassed because it doesn't even feel like you were on call. But for some of them, you'll be awake for most of the call. Um, yeah, the other thing with internal medicine, by the time you leave internal medicine, you'll know how to run a resus. If you're on call and the patient crashes, they don't call the senior, they call the intern. And you get there, they'll say, the patient is not responding. You're expected to start the resuscitation while waiting for your senior to come, whatever the case is. So yeah, by the time your 3 months is finished, you'll know how to do CPR quite well, and you'll have Nisha's voice at the back of your head, and yeah, but you get a hang of it. At first, it's a very nerve-wracking experience, but I found that as time went by, yeah, you get used to it, and it becomes a lot more manageable. And when you have to resuscitate a patient, it doesn't always mean the patient, is they're on their deathbed and whatever the case is, you need to do CPR. But you might have a very unstable patient, hypoglycemic or whatever the case is. So you'll learn how to manage a lot of those things, because when that happens in the ward, the nursing staff does not call the senior, they call the intern, and you're expected to go there and um, do whatever needs to be done for the patient, and obviously in consultation with your senior, make sure they're aware, and yeah, they'll let you know over the phone if it's something that they can help you manage telephonically. But the supervision there is obviously very good. So for the most part, they'll let you know what to do, but they're already on their way. So while you're still busy resuscitating, they'll get there and then they'll also assist. Um, yeah, the internal medicine is a very organized department, and I find that it makes your life a bit easier as well, knowing what's expected of you as an intern and the predictability of the rotation in terms of the day-to-day stuff. Um, you will do weekend covers. It's one thing they didn't tell us as students, which I find very, yeah, it takes away some of your free time, man. If in a firm there are four of you, which is two seniors and two interns, you will have to do covers. You have to cover at least one weekend, where you go in on a Saturday and Sunday morning, see your firm's patients, and do what needs to be done. The nice thing with internal medicine is that you do the cover alone, and then if there are issues, you discuss with the senior. But what that means is that you only have to do maybe one weekend cover, as opposed to some of the other rotations that I'm yet to get to, where you'll cover with the senior, but it means you have to do more covers. Yeah, but even with the covers, you should be done by 11, half 11, latest 12, if you're in one of those firms that just have a lot of work, and then you can start your day. But yeah, you will get a lot of time to yourself in internal, even after hours on during the week, and you'll get weekend. So the quality of life is, I'd say, okay. But obviously, some might need to start citalopram. Those patients are very ill. Um, some of them quite a few of them will pass on. You will have a call where you have to certify 4, maybe even 5 patients. And again, with certifying patients, they don't call seniors to certify. The intern goes. If they say, the patient is no longer responsive, they can't read vitals or whatever the case is, and you get there, and sometimes you really just have to certify and make sure, examine the patient. If they're no longer, alive, then you certify them. It's a numbing experience, I would say. Yeah, it's one of those things you also you get used to in internal medicine. By the time you leave, you will have certified quite a few patients. Yeah. Um, yeah, again with the supervision in internal, it's really great. You are expected to do quite a few procedures as well. But you're not going to do any of that stuff on your own. If be it a BMAT, if it's a biopsy, one thing I found in Gauteng that is different to what I was used to in KZN, they biopsy a lot um, in internal medicine, kidney biopsy, liver biopsy. You get to see a lot of that, and yeah, and if you are performing the biopsy, be it a BMAT or whatever it is that you are comfortable with, you will have supervision. You will have someone there to guide you. You will have seen it, of course. You will have been taught how to do it. But if you're the one doing it, you don't have to worry about being alone or anything. The teaching again is quite good because they 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 spend a lot of time teaching the registrars and the students as well. And you're there for the academic rounds. You benefit quite a lot. Internship is nice. You get to hear the questions being asked. You think about the answer, but you're not always expected to be the one that gives the answer because there's a medical student there who needs to prepare for an exam. So they are the ones who primarily need to be able to answer the question. But it's a good way of gauging yourself as well to see, do I actually know this, or is this an area that I need to improve on? But yeah, overall, you will leave internal medicine very comfortable with managing medical emergencies, your DKAs, your CVAs. You'll see a lot of those. Yeah, by the time you leave, you'll be very comfortable because you get to see them in that acute setting when they just present. You see what the management plan is, and you get to examine them as well in that acute state. So by the time you leave, you'll be fine. I think that they do a good job of preparing you for after internship. Um, the other rotation is pediatrics. I've not rotated in pediatrics as yet. It's my last rotation of the year. I do obviously have friends and people that I was in uni with who are in peds right now. Um, yeah, so pediatrics, you're either in neonatology or you're in gen peds. If you're in neonatology, you're seeing the patients in the postnatal ward, which is where I get to interact a lot with them because um, you'll be seeing the mom while the peds people are seeing the baby. So yeah, again, if you're in neonatology, if you're covering postnatal, be it labor ward or the postnatal ward itself, you're expected to see all of the patients, and then inform the senior when you're done, and then around and um, do whatever ward work is there. If the patient needs to be admitted, if you see that the patient is yellow and they need that TSB, whatever the case is, that then becomes your responsibility. But again, you will have seniors there to guide you throughout every step of the way. I think that's one of the benefits of being in an academic institution where you have registrars, lots of consultants as well. Um, yeah, a lot of the tricky stuff they'll help you navigate through. One thing that is different here is that even if you're in neonatology, if you've rotated in KZN, you'll know that you go catch babies in theater. if you're the intern and there's a Caesar, they call peds, the intern goes. Here the regs go. So yeah, I'm not complaining, but yeah, obviously it's a bit different to what I've seen in KZN, where even in the tertiary institutions like Grays, the interns catch the babies, and then if there's a need for resus, or if you're struggling with the resus, then you call the senior to come and help. In terms of calls in peds, um, so again, it's divided into general peds, and neonatology. So if you're on call in gen peds, there's one intern on call, and then there's one senior. So you guys handle gen peds, and then neonatology will have one senior and one intern as well. So you guys see at NICU and all of the patients in high care, and the people in Gen Peds will see the patients in casualty as they present, and then also if there are any issues in the wards as well. If you're on call on weekends in Peds, um, Saturday calls especially quite hectic, I would say. After the call is done and your post call, you're expected to see the ward on your own. You see all of the patients in the ward, you round with the consultant, and then you carry out the plan for the day. So you will find that on a Saturday, the intern on call for peds leaves quite late when they're post call on Sunday, because you have to see all of the patients, round with the consultant, do the ward work. Um, and if for whatever reason there's a resus, and they have to prioritize that, and it delays the round or whatever, it means that you're post call and you're leaving work very, very late. So yeah, but then again, you're doing 5, 6 calls at max in pediatrics, maybe 2 weekend calls a month. Um, they emphasize a lot on the fact that you can't leave work early when some of your colleagues are not done. So you will have to work as a group and as a team, make sure everything is done before you can go home. Um, in terms of sleeping during the calls differ. You will find calls where you don't see a lot of patients in peds. Um, if you're in Gen Peds. But if you're in neonatology, what I've noticed is they get a lot of sleep. For the most part, the calls upstairs are very nice, and yeah, I have friends there right now, always asleep, and yeah, so I think that's nice. Supervision and teaching in peds. Um, Yeah, there's a lot of teaching that goes on there. Again, it's primarily for the students and the registrars, but you benefit a lot from it as well. You are also expected to present topics as an intern. Um, it's I think it's the only rotation where if you're post call, you're expected to present patients in the morning as well. So there's a lot of teaching and learning that happens in the rotation. Um, but yeah, I would say not it's not much of a deviation from what I was used to in KZN. Yeah. In terms of Gen Surge was the first rotation I did. Um, by far my favorite rotation this year. You get a lot of exposure into the discipline as a whole. You get to go to theatre quite often. You get to assist in a lot of the cases. So if you're someone that likes surgery and is hoping to pursue it, I think you'll find Kalafong quite nice. And again, it's one of those rotations where at the end you'll really feel like you've been properly prepared. Um, to be an intern and manage surgical cases acutely as they present, wherever you may be after internship. In terms of the day-to-day in Gen Surg, you will leave reasonably early, depending again on which firm you are in. Um, some firms are a bit more hectic than others. But even then, you're not going to leave, at night because you are stuck doing ward work, or seeing the firm's patients until very late. But some firms do become very hectic, and it's a bit more demanding than others. But quality of life there is really you'll live. Yeah, you'll be fine. No need for citalopram there. Um, but in terms of the calls, Gen Surge calls are very interesting. You might be having one of the quietest calls of your life, and a taxi driver goes head on into a truck, and suddenly you have a mass casualty, and that night is completely ruined. Um, you have the patients present mostly on their deathbed. And so it's up to the team on call really to be on their A game and make sure that people, survive and live. If you're on call, there's two interns on call all the time. When I was in Gen Surge, there were a lot of calls where there was one senior, but towards the end of the rotation, I noticed that there started being two seniors on call for the most part. So you would have a senior registrar and a junior registrar, or a senior registrar and an MO on call. So if you're on call, again, you see the patients in the main casualty, because the understanding is that they're a bit more stable than the patients in resus. So for them, you can see them and then review with the senior, and then the senior will then see the patients in resus and then ask for assistance in terms of whatever needs to be done for those patients. Um, Again, the calls can switch up on you really quickly, so you must really be on your feet at times, and just be a very efficient intern. If a patient is suddenly, presents they're bleeding, be it internally, they need to be optimized, go for data. You have to play your part in terms of making sure they're typed and screened. They have lines, whatever the case is, and just, yeah, when the call switches up, you can't then be asleep and um, expect that the seniors will carry a lot of the weight. A lot of the work will also fall on you to make sure that, things are done. But it's really one of those rotations that I found, especially coming from being a COVID medical student, and not getting time to rotate in general surgery when we were students, and not getting the necessary exposure. Um, yeah, rotating in Gen Surg was quite nice. We saw a lot of things there. There's a lot of surgical procedures that you get to witness while you're assisting. Um, yeah.
Sorry to disturb you. Yes, because of time, I think I just move as quickly to the next question because it's taking me about time now. So,
Okay, okay. I saw you
but if there's
unmuting.
something you want to say on Gen Search, you can briefly summarize the last parts.
Sure. Um, the last thing I would say is in terms of supervision and in terms of teaching, again, it's a really nice department to rotate in. They will teach you how to do a lot of things that you may not have had an opportunity to do as a student. Because again, I'm not sure if the experience is different for you guys now, but we were COVID students, and we didn't get to spend a lot of time in Gen Surg, both in PMB and when we went back to Durban. So yeah, the teaching, the supervision was great. So it was a really nice rotation to be in. Um, yeah, I'd say that kind of wraps it up. Um, I've not obviously rotated in second year, so I can't speak on those rotations. But what I will say briefly is that based on what I've seen, it gets a lot better. First year is terrible. Being a first year intern is unfortunately not something you can avoid, but the rotations are quite hectic. But from what I've seen, second year interns are really chopping life. So yeah, you'll be fine. Yeah.
So are there any like DQs there? If yes, like are they well maintained, safe, and also water and everything?
Um, there is a DQ. The DQ is in Pretoria West Hospital, which is about 10 to 15 minutes from Kalafong. Um, they do provide transport in the morning and in the afternoon, and if you're post call, um, they provide transport because it really shouldn't fall on you when you applied to Kalafong. But so they provide transport, which is quite nice. So do you need a car? If you're living at DQ, not necessarily. It's not a must. It is obviously a lot more convenient, but if you're still settling in, you want to get your finances in order, you're not one of those guys that will buy the car in December, whatever the case is. You don't have to rush. They provide transport, which is quite nice. The quality of the DQ. um, the infrastructure in Gauteng in general, I would say, is quite old. But I found that a lot of people exaggerated just how bad the DQs were. When I got there, I found that it was quite okay, actually, in terms of the quality of the room that you're going to get. You might, for the most part, if you're a first year intern, you're going to get a bachelor or you're going to be in a sharing because they don't have enough bachelors for all of the interns. Or you might be in a single room where you have an actual room and then a living room and a kitchen and your own toilet. Um, yeah, the quality of the rooms is okay, man. It's if you've lived in Saint Helier, if you've yeah, I'd say it's more like Saint Helier than anything else. It's you can live there. There's not really an absolute need for you to go out and find your own place. It's just something you can do because you want to do, but you can't really say there's an expectation that you must because the DQ is just so horrible. I wouldn't say that at all. Um, in terms of paying, you pay the 900, which is the standard price. They do charge you for water. One second. They charge you for water and electricity, but it's not much. Water is like 18 rand, garbage removal 24 rand, parking 100 rand. So you'll end up paying like 1.1, 1.2 for DQ, which is not that bad. If you think about it, you're not going to find a place to rent at that price. Um, but obviously, we differ as people. Some people want to move out of DQ and find other places to stay. There are places nearby next to the hospital where you can stay. There's a place called Little Manhattan where a lot of them, the interns stay. It's about a 5 minutes drive to the hospital. Um, some people walk as well. It's really not that bad. So yeah, there are places nearby that are affordable. Some people go as far as Centurion to live in. You can find nice places there as well. A little bit more expensive, of course, but also the further you go from the hospital, there, then a car becomes an absolute need. But yeah, there are places nearby that are safe, that are in really good condition that you can consider if you want to rent. Obviously, it's Gauteng. The cost of living is a bit higher than maybe in KZN. So you'll find that rent costs a bit more here than it would in KZN. So yeah, that plus the fact that you don't have a rural allowance, it means you need to sit down and really consider your options. If you are in DQ, it's not furnished. You'll find a stove when you get there. That's all you're gonna find. You're gonna find a stove. You need to come with a fridge. You need to come with a bed, um, and everything else. So I found that to be quite hectic. If you're just coming, and now suddenly you have all of these costs. So it's something. It's definitely something worth considering. If you are allocated to Kalafong and you plan on staying in the DQ, as soon as they contact you and say you can apply for DQ, don't wait. Respond to the email and send them the necessary documents immediately. Because how they did it with us is they allocated the bachelors on a first come first served basis, and then the people who responded much later ended up in the sharings. So just make sure that you try and respond early.
Mm.
The living environment, Atteridgeville is a township. It's a township in South Africa. I think that's as much as I can say. If you're found gallivanting in ungodly hours, you will you'll yeah, you'll pay the price. So yeah, it's worth keeping in the back of your mind that it's a township in South Africa. So you can't just be in, on the streets and at night, whatever the case is. It's not that kind of place. But what I noticed is that a lot of people have fun inside DQ, which can be a bit of a problem for some people. If I were to describe it, I'd say imagine a race, but the people they have money. So it does become a bit of a problem sometimes, yeah. But I think that's as far as I would go with DQ. Maybe I can then share pictures from people who live there with you guys to see. But yeah, very decent, I would say.
Okay, we'll appreciate the pictures, and then we'll share them on the group with all other students. Okay, so on one of the questions most people shy away from, but yeah, on the salaries, what is the basic salary for interns before and after
Um,
taxes deductions?
um, Xavier and peanuts this side. They took some water, man. Um, Compared to my friends in KZN, yeah, no, we're earning peanuts this side. But it's if you're in DQ, you can expect around 46K, 46.5 after they've taken um their money for DQ itself. Um, So I stayed in DQ and then I left. So yeah, if you're there, then you should expect around 46. The bad thing is that they take a while to stop deducting once you've left DQ, I would say. Um, with the basic and the overtime, you get a fixed overtime. It doesn't depend on the calls you do and that type of stuff. So the 46 is inclusive of your overtime, and it's after their deductions. And so if you then sign up for other things that will deduct money on the side, then you'll have to take that into account on your own. But yeah, it's around 46, around 46, uh 46.5. um I'm seeing messages pop up, but
Or we will ask the
oh, okay.
teachers. Okay, so
Yeah,
are
but
there any
yeah.
like additional allowances? I heard you said there's no land allowance, so are there any other?
Mm-mm. For this evening, nothing more. No, no, there's nothing else. That's all you're gonna get. Yeah. If it's okay, you can live with it. Just don't speak to your friends who are in other places. As long as you don't know how much they earn,
Okay,
it'll feel like it's fine. But the moment you know, then you'll start feeling like it's not much. Yeah.
okay.
But there are
I
no
know.
other allowances. You're not getting any other allowance. There's no danger allowance. There's no rural allowance. Nothing. You just get the basic salary and the fixed overtime.
Okay. So I know it is safety you are in Johannesburg, so obviously, or you're in Gauteng, obviously there is like life outside work. So like is like do you get time for like hobbies or relaxation time like after work?
Yeah. What I'll say is, in your 2 months in obstetrics, your free time is for resting. That's the one rotation I would say you're not gonna get a lot of time to be outside and stuff. But for the other rotations, yeah, you get time, man. You get time, you make time. But yeah, like you said, man, it's Gauteng. There's no shortage of things to do here. I have friends um in Johannesburg, some of them are in Pretoria. Um, you will never run out of things to do in Gauteng. That's all I can say. When I describe it, I like saying that Gauteng is one of those places where Satan didn't send demons; he came here himself. So you'll enjoy this place. Yeah. And yeah, you get quite you get a lot of time because in the rotations where you're doing the covers, you do get to spend time in hospital on weekends. But that's a you thing because some people will go in very early, do the cover, finish, discuss patients if there are issues, and then go and enjoy their weekend. If you're in internal, you're doing maybe 2 days of weekend cover, so a Saturday and a Sunday, or however you split it up with your seniors. If you're in surgery, you do more because you do the cover with a senior. So when you're on cover, there's a senior on cover as well. So you end up spending more days. But then again, it's up to you. If you go early, you do the work, you get to go home and enjoy your spare time. But yeah, you also get a lot of you get weekends where you're not working. So in a month, you'll probably spend 2 weekends in hospital and 2 weekends off.
So I just take some questions from the Google Doc that you sent earlier on and also from the messages. So the first one is as a non-South African intern, do you think I'll have challenges with language barrier or xenophobia, especially on the language barrier? 'Cause I think you're from KZN, so
Ah, you will learn. You will learn. It's fine, man. The people here are quite great. There are people who will frown upon the fact that you can't speak their home language. But for the most part, the people are chilled. They get it. You will also learn the languages, even if you can't speak it. But by now, I understand what people are saying, and I can respond accordingly. I can take a history from people who don't know English, and I can find ways to communicate with them and make sure that I understand exactly what they're saying. So that's not a problem. Thing is, in Gauteng also, you're seeing a lot of foreign patients. Um, yeah, if you're on call in obstetrics, Sengati, you should know a bit of Chechewa as well. You're gonna see patients from all over Africa, Malawi, you know, Zimbabwe, all of the African countries. You'll see a lot of those patients, but it's a lot more prevalent in obstetrics than in the other rotations, I would say. So yeah, there will be patients where no one there can communicate with them. So you might be relying on Google Translate or whatever the case is, and you have to take informed consent for an operation. So it does present a bit of a challenge, but you will find ways, if even if it's calling the husband to translate or the brother or something, but you'll find a way. It shouldn't be something that bothers you a lot. Yeah.
okay. So there is a follow-up question, and like, can you emphasize on the like xenophobia issues? Is like, are people xenophobic their side or not?
They're okay, man. They're okay. They'll they'll make fun of you for not understanding the language and stuff, but it's not something I would take to heart. I certainly wouldn't go as far as calling them xenophobic. They are not. The people here are very kind people. Yeah, even the seniors here. Perhaps that's something I didn't mention. Even the seniors here, are very kind people, very kind consultants. So xenophobic, no. No, definitely not. Will you be picked on? Yeah, you will obviously be picked on. If you go to KZN and awazi ukukhuluma isiZulu, you'll also be picked on. But xenophobia, no, definitely not, man. No, they're very good people, and you will learn. Yeah.
Okay. Our second question is, do you think living in Pretoria East will be feasible?
Um, we differ as people. There are things as a student you tell yourself, I won't compromise on this when I start working. For some people, it's a car. For some people, it's the location they live in. For some people, it's both. I don't know if you can do both. I don't know. You figure out what your priorities are. I left Pretoria East. I don't live there, but I don't think living there is a problem per se. I go there, obviously. Some of my friends are there. Some of my um, university colleagues are there. So if we're going out to the Shisanyama, whatever the case is, then we might meet up there and then drive to where we're going. So but the place itself is okay. But again, you have to take into account the fact that it's a township in South Africa. Um, Hijackings will happen. There might be safety concerns, but I don't think it's anything outside of the ordinary or outside of what you would expect in the context of our beloved country, unfortunately. Yeah. So, yeah.
Okay, was Kalafong your first option when applying?
No, but Gauteng was my first choice in terms of provinces. I wanted to go to Helen Joseph. I wanted to go to Helen Joseph, but Kalafong was my other option in Gauteng, and so I got Kalafong. Yeah, it was my second option, I would say. Mhm.
Where do the second year intern rotates? Clinics, how far are they, and is the transport provided?
Um, The rotations, the one rotation that will take you out of, the hospital and all of that stuff is obviously family medicine. You do your casualty time in Kalafong, but you do go to the district hospitals. The nice thing is that Pretoria West is the district, so you live there and you will spend some time rotating there, so you don't need transport for that. Um, for psychiatry, you will be based in Kalafong. Um, yeah, I think they go to West Kopjes as well, which is not that far as well. It's a reasonable distance. What I don't think they provide though is transport for that. Even for the rotations where you're going to the clinics and stuff, I don't think transport is provided for that. No. Yeah. So yeah, that then falls on you, unfortunately. Yeah, but for the most part, even as a second year, you'll rotate in Kalafong for ortho, for anesthesia, most of family medicine. Yeah.
Okay. Do they subsidize you now that you are out of EDQ? Oh,
No, I get my basic salary and it's up to me to, well, they're not charging me for DQ because I don't
okay.
live there, but I'm still getting my basic salary with the fixed overtime and then I'm paying for where I live, yeah, out of my own pocket.
Okay. Those were the only questions I received. So, before we wrap it up, we're going to play a short game. Just to You have to rate out of five. So five being the best, one being poor. So, how well do you feel like as an first intern you balancing your personal life and your work life?
Uh, yo, three,
Okay.
sometimes maybe two, sometimes one, but I'd say three on average.
With training and learning opportunities or Kalafong, how would you rate them? Five being like best, like there are opportunities, one being, opportunities at all.
I'm sorry, can you repeat the question itself?
Or training and learning opportunities. How satisfied are you with that?
Um, I would say for most rotations, four. Um, for obstetrics, where I would have liked to cut, do more Caesars, I'd say maybe two. Yeah,
Okay.
but for most rotations, definitely a four.
Yes. With support from your seniors, how will you rate the support you get from your seniors? Five.
Five. Five.
Okay.
Amazing. Yeah.
Then we have living conditions. How will you rate living? Okay, we'll use that DQ because you want, like, you were living in the DQ. So how will you rate living in the DQ out of five?
I'm too biased. That's the problem. Three. I'd say a three.
Okay, three. So the overall experience of both, like, living or conditions, working at the hospital, and your first year internship so far, how would you rate it?
Four. Four.
Okay.
I'd say four. I would say five, but it's far from home. Miss the family. But apart from that, I'd say four. Yeah.
Thank you so much. Before we close, we have just one question. Today is the okay. Tomorrow is the last day for uh, application for internship, especially for the final year students. So, what advice would you give to an like final year student right now who is considering like applying there in Gauteng or like any hospital in South Africa in selecting like the choices?
Uh, I would say doesn't really matter where you go. Um, Internship, the experience of internship itself will be more or less the same. There are obviously exceptions to this, but for the most part, it doesn't matter where you end up. What does matter is everything else, the everything else outside of work. I think that's something that you should really consider. Family, your spouse, um, the quality of life, and outside of the work environment. If you're an intern, your workforce, wherever you go, you'll be expected to work very, very hard. So, yeah, go where you feel that you will be most yourself, and where you will have a lot of support. You can't go through internship on your own. It would be nice to have friends and family around. I would say prioritize that quite a lot, actually. But at the same time, um, I think that it's the only opportunity you're going to get to be outside of your comfort zone. Um, I don't think there'll ever be another time in your life where it's okay to just up and leave and go home. After this, you're probably going to end up with a wife, a fiance, a husband, kids, whatever the case is. So, internship gives you that opportunity to go out there and explore something different. But at the same time, you have to consider the fact that because of the nature of the work that we do, um, and the strain that it takes on you, especially as a first year intern, I would say prioritize being in a place where you'll have support. Support is everything. Yeah, yeah.
Thank you so much for that. So thank you guys for joining, and thank you so much, Dr. Mkhize. Having you was wonderful. Thank you so much.
Thank you. Thank you
I
so
think
much.
Thank you. So we'll wrap our session now. Thank you for joining. I think it was the last session as internship we're having this year. Check out our YouTube page, and also we'll be still in touch on our WhatsApp group. Yeah, thank you everyone for joining.